Utah Cares. A lot of complaints today that bill's not going to go before the full House. How do you respond to that? You did give it a hearing.
How'd that go? How'd those votes go? Far be it for me to predict anymore. I'm just wondering how that went. How'd it go?
4994, and you can decide which went with which bill.
So what was the question?
Well, some people are complaining today that it didn't go before the full House. You even had a Republican last night voting in favor of Healthy Utah, saying that it should go before the full House.
So
every member should have to vote.
Is the question, should a failed bill in committee go to the floor? Is that your question?
Well, my question is, how do you respond to that criticism?
I don't know what I'm not being argument. I don't understand what the criticism is. What's the criticism? That the bill failed?
Well, that it did not go to the floor for a vote by the full House.
Well, if they're criticizing that the bill failed, I mean, I don't know. I don't know. I don't know how to respond to it. We don't send bills that fail out of committee to the floor. We actually
have a House rule that says for a bill to be heard on the floor, it has to have successfully passed the House. Doesn't matter if it's a House bill or Senate bill, it first has to successfully pass the House committee in order to be able to go to the House floor.
I understand the rule, but clearly you're the speaker and majority leader, and if you had wanted that bill to be heard on the floor of the House, it would be heard on the floor of the House. So I guess the question is, when the governor says, I want this to be heard on the floor of the House, and it isn't, then people begin to ask, why hasn't it been, but why won't it be heard on the floor of the House if that's what the governor of the own party
Well,
wants?
let's pick a path. We've talked a lot about process in here as we've met during this session, and we've talked about what that process means. Are we saying that in a generational decision that the process that we've used and that the process that in the path that every bill takes, being vetted and sent from a rules committee, heard in a standing committee, passed favorably, brought to the floor of the House, should be circumvented on this generational decision? And should we ask, should generational decisions that some would say would have a bigger impact than the annual decisions that a legislature make, should we by design make that an easier path? Should that be an easier process than the one that every other bill's going through? I think that that bill being sent to a committee, having it vetted by a committee, there's nothing to apologize for. That's the process that the legislature uses, and that's what we did.
Supporters, including some House Republicans today, are still insisting it's not over. What do you think of that perspective?
I don't know what it means. I know that we have a bill that Representative Jim Dunnigan presented to the committee. The committee supported it. That bill has been read onto the calendar. It's going to be debated. I think this coverage gap, if we're talking about providing health care coverage for those who currently don't have it, that issue and that debate is alive and well. And we await the bill's hearing on the floor.
Do you have the votes in the House for Utah Cares? Enough people who don't want to do anything at all, will they come over? Democrats have said they won't vote.
I have learned. I'm done predicting anything. We will have to wait and see what happens.
Okay, so in that sense, then, is there still some opportunity to meet somewhere in the middle between Healthy Utah and Utah Cares, even if it does pass the House?
Let me tell you. Here's this whole thing. Let's take a different issue. Let's take the big announcement yesterday on the religious liberties and anti-discrimination. Typically, when a bill comes and you have interested stakeholders, people get together and they work out a compromise and you get that bill going. I don't know that this issue has followed that path, and I don't know that that's the fault of the House, but there has not been going upstream, finding that common ground and finding areas where you can find consensus and moving that forward. There had been a very strong desire for that bill, as passed by the Senate, to be heard in a House committee, and that was a pretty clear intention. And that's so. Is there room for compromise? I don't know that the House. I don't know that Representative Jim Dunnigan ever wasn't willing to find what we thought is the common ground that can build consensus and get support here in the House. That's where we've always been. We have a bill. Representative Dunnigan now has a bill that's moving through that process, and we hope to leave this session better than we found it in terms of what we can do for people and the coverage we can provide. That bill's still pretty, I mean, it's expanding healthcare coverage. That's a generational decision. It's one that I would argue that a number of years ago, advocates and others would be dancing and excited that this bill is being presented and potentially passed.
Representative
Sell it to the
Dunnigan,
Senate,
do you foresee pushing back on any changes, or are you open to changes to the bill?
I've always been open to try to better legislation, this legislation as well as other legislation. So even yesterday, I met with Senator Shiwazawa at least a couple of times before the committee hearing, and he and I were brainstorming, and we've had regular communication. I met with the Lieutenant Governor yesterday. So I'm always open of finding the right path. And the speaker described it correctly from the very beginning, going back to a year ago. I have welcomed ideas, I've welcomed solutions, and I don't think I ever closed my mind.
You say this is a generational issue. Has there been enough time, is there enough time to thoroughly vet Utah Cares?
Well, you'll find whether either bill has had, you can go back to the healthcare reform task force that's been working. You'll find this whole space and how you expand Medicaid coverage, if you do it, how you would do it. These are all very familiar policy discussions and decisions. We think there's ample time. It was important to have an additional standing committee hearing because we have so many bills that are trying to have that time with their bills. We authorized an additional committee to have this bill heard, and with its successful passage, we're hoping that this gets over to the Senate for an additional public hearing in the Senate, which would again add more scrutiny to this bill, and that's a good thing. We hope to see that happen. So yeah, I would say there's time to do that.
So you're gonna have to move it up on the calendar to get it there then?
You know what, that calendar, we're gonna come back in tonight, and that calendar is not absolutely packed. Sometimes you see it this time of year, after the last bill's printed, you'll see the 36 more or some number more that's not there. We're not seeing that. It's one of the reasons we're coming back this evening to do more of our floor time. I think that bill, under normal circumstances, could be heard tomorrow. I think if we want to have a time certain so that people know, I mean, it's certainly still an option, but I think it'll be heard under normal circumstances.
Doug Wright in the rally today said that if Healthy Utah were on a secret ballot, that it would pass. I just wanted to give you a chance to respond to that.
You guys didn't like a caucus that wasn't open where we talked about it. That kind of caused some angst. So I don't know that we're all into secret ballots. I think that would offend everyone in this room, the idea of a secret ballot.
But do you think he's right when he says it would pass if we're on a secret ballot?
Well, what's the connotation? I don't understand what, I mean, no, I think as we've tried to get people, as we've talked about this bill and we've been frank and we've had an honest discussion, I think we've got a good read. Look, if the idea is that this leadership team can coerce a vote out of the House, look at the numbers we're talking about. Look at the diversity of the districts that are represented. That's not an option. So no, I think people are voting their conscience. I do. I wouldn't question the motives of House members.
I think the vote in the committee last night was very reflective of the caucus feeling. You saw some that supported Healthy Utah, about how many did. You saw some that are looking for some middle ground. As I analyze the numbers, the vote in the committee last night was almost exactly reflective of the caucus position for the same percentage that wanted to help Utah, the same that didn't want to do anything, and then the middle ground. It was very reflective. And I have not worked the committee to obtain an outcome. They voted, they heard the debate, they asked some good questions. I think they're pretty well versed in it. They did a good job.
The connotation from supporters, I think, centers a lot around polling. Talk to us about where you get your perception from and your interactions with your constituents that leads you to believe that people in your area do not support Healthy Utah?
Well, for my district, I pulled my district, and it was roughly a third, and a third. Not exactly, but pretty close. I had a third that wanted to do Healthy Utah. Had a third that wanted to do a more moderate approach, and I had a third that just didn't want to do anything and keep it as it is. So, and it's difficult to ask a question in a poll. We've had numerous conversations about Medicaid expansion. It's complicated, it's technical, there's a lot of nuances, and it's a challenge to ask a poll question.
The barometer I use are my town hall meetings, because I haven't read the question that you can ask someone on the other end of the phone that would reflect the complexity of Medicaid expansion, or the challenges of doing it, or the sustainability. I haven't heard the question that you can ask to get an answer that you would base your public policy from. Now, if you go into a town hall meeting and you start drilling down on some of what this means and what you're doing, that kind of response back, I think you're getting a better idea as you're talking to your constituents a little bit more in depth than a polling question. And as I've done this, and I think this is happening, and we're hearing this as we come back from our weekends during the general session, as those meetings, longer meetings and longer dialogue with constituents happen, people are supporting their representatives. And I think that's an important part of it. But it's hard to get down to this issue, as big as it is, as tough as it is, in a polling question. I'd caution against
Do you think
governing
More
that.
Do you think the nature of some of the supporters who have come out, such as the chamber, some prominent families, are kind of directing some of the opposition?
Yeah, ask yourself this question. Why? I think 5 years ago, if we had Representative Dunnigan's bill, I think you'd find many people very excited at the prospects that you could start expanding or providing healthcare coverage for those that don't have it. 5 years ago, policymakers weren't there. It wasn't a moral imperative to do this like it is now. What has changed from 5 years ago till today? The only thing that I think has changed in a significant way to change the narrative are those federal dollars. So now you're talking about dollars. I know we want to talk about, and I think that some of the things we worry about when we talk about people is the idea that what we decide to do, can we honestly sustain this? And can we make sure it's a program that we will provide and not treat people like yo-yos? And I know everyone wants to sign up for I promise I don't want it after 2 years if you'll give it to me today. I know that's what I'm told everybody wants. We've talked about it before. I've watched that on a much smaller scale and a much smaller population with dental and vision, Medicaid when you expand it. And my takeaway has been, you better be in it for the long haul. And that's one of the things I'm most proud about Representative Dunnigan's bill, is his bill does not contemplate taking this away anytime soon. This is something we plan to build and not leave this space. When you get above 138%, that's where we start to feel, or above 100%, that's where we begin to feel that this is not a sustainable program. Spoke with Congressman Paul Ryan last night, 5:30. He is the chairman of the Ways and Means Committee in the U.S. Congress. He told me that a 90% match is not sustainable. He says that this is a president's program of which he wants to see with his legislation be successful, and he has pushed those matches to 90%. 90% federal matches are unrecognizable in the U.S. Congress, but for this issue, in his mind. And when you talk about a new administration, he is saying that Democrat or Republican, that will be one of the first areas. If you're looking to cut budgets, you're going to look at that formula, because cutting formulas is easier than cutting programs. Cutting programs that people become dependent on are a lot more difficult to cut, even in Congress. The formulas and the match, that's easier to address. And he does not believe that the 90% match is sustainable at all. He thinks you have 2 years of an Obama administration of which you can certainly depend on it. But after that, he does not believe that that is realistic.
Okay, last
The
question.
governor today mentioned again the prison move from Joyberg. He was talking about the cost associated with your program. saying that that money has to come from somewhere. And I think the number was 50 million, education, transportation, or relocating the prison. Do you feel that that's being used as leverage in this debate to get something done on Healthy Utah?
No, I don't.
Why would you bring that up then?
You'll have to ask them.
Can we go back to anti-discrimination really quickly?
Yes.
What do you expect to happen with LeVar Christensen's bill, 322?
I believe it was heard in committee last night, yesterday, and received a favorable recommendation, but close. And I think that Representative Christensen has worked very hard on that bill, and I think it is part of the discussion that's going on. You have in a bill sponsor in Representative Christensen someone that does not want to interrupt or take away from the great progress that's made. He is a lawmaker that has worked very hard in these areas of public policy, and he'd like to contribute in a positive way. That's his complete motivation, and I think that's available to him, and his bill will go through that process.
Okay, thanks guys.
Sorry, I gotta get him.